Most people experience hiccup from time to time. They can be uncomfortable and sometimes embarrassing, but they are usually short lived and sometimes indicate more serious problem. In this video, we will discuss about what causes hiccup, how to stop them and when to see a doctor. Hiccups are involuntary contraction of diaphragm, the muscle that separates your chest from your abdomen and plays an important role in breathing. When you inhale, it pulls down to help to pull air into the lungs. When you exhale, the diaphragm relaxes and air flows out of the lung. But sometimes diaphragm become irritated. When this happens, it pulls down in a jerky way, which makes you suck air into your throat suddenly. When the air rushes in, hits your voice box, your vocal cord closes suddenly, making a hic sound, and you are left with big hiccups. Some things that irritate diaphragm are eating too quickly or too much, and irritating in stomach or throat, feeling of nervousness and excitement. Almost all cases of hiccup last only for few minutes. Some cases of hiccup can last for days or even months, but this is very unusual and it usually indicates some medical problem. Make an appointment to see your doctor if your hiccup lasts more than 48 hours or if it causes problem with your eating, sleeping or breathing. To stop your hiccups, drink a glass of water, hold your breath for some time, sip on cold water or do gargling with ice water.